Question 1. A 14-month-old child is brought to the emergency department with a 2-day history of cough and fever. The nurse observes nasal flaring, intercostal retractions, tachypnea of 58 breaths/min, and oxygen saturation of 92% on room air. While obtaining a history, the nurse notes the child suddenly becomes quieter and less active than during the initial assessment. Which interpretation by the nurse is most appropriate? A. The child is becoming comfortable due to reduced anxiety. B. The child is demonstrating normal fatigue from illness. C. The child may be progressing toward respiratory failure. D. The child is conserving energy and improving clinically. Answer. C. The child may be progressing toward respiratory failure. Rationale: a sudden decrease in activity, irritability, or responsiveness in a child with respiratory distress may indicate worsening hypoxemia and impending respiratory failure. Behavioral changes often occur before dramatic changes in vital signs. Question 2. A 3-year-old diagnosed with severe bronchiolitis is receiving humidified oxygen. Assessment reveals suprasternal retractions, expiratory grunting, respiratory rate of 64 breaths/min, and diminished breath sounds bilaterally. Which finding requires immediate intervention? A. Respiratory rate of 64 breaths/min. B. Suprasternal retractions. C. Expiratory grunting. D. Diminished breath sounds bilaterally. Answer. D. Diminished breath sounds bilaterally. Rationale: diminished breath sounds may indicate severely reduced air movement and impending respiratory failure. This finding is more concerning than tachypnea or retractions because it may suggest exhaustion and inadequate ventilation. Question 3. A pediatric nurse is caring for a 6-month-old infant admitted with respiratory syncytial virus, RSV. Which assessment finding is the most reliable indicator of increased work of breathing? A. Decreased appetite. B. Nasal flaring. C. Mild fever. D. Increased sleep duration. Answer. B. Nasal flaring. Rationale: nasal flaring is a classic sign of increased respiratory effort in infants. It reflects attempts to reduce airway resistance and improve oxygen intake. Question 4. A 5-year-old child with severe asthma suddenly develops a normal respiratory rate after several hours of tachypnea. The nurse also notes minimal wheezing and increasing lethargy. What is the priority interpretation? A. Asthma treatment is effective. B. Airway inflammation has resolved. C. The child is entering respiratory arrest. D. Anxiety has decreased. Answer. C. The child is entering respiratory arrest. Rationale: a child who suddenly stops wheezing and becomes lethargic despite previous severe symptoms may have critically decreased airflow. A silent chest is an emergency indicating impending respiratory arrest. Question 5. A 2-year-old arrives with croup. Which finding indicates severe upper airway obstruction? A. Barking cough. B. Inspiratory stridor at rest. C. Hoarse voice. D. Mild restlessness. Answer. B. Inspiratory stridor at rest. Rationale: stridor at rest indicates significant airway narrowing and severe obstruction. It requires immediate evaluation and intervention. Question 6. The nurse assesses a toddler with pneumonia. Which finding suggests hypoxemia is worsening? A. Increased playfulness. B. Bradycardia developing after prolonged tachycardia. C. Warm extremities. D. Increased oral intake. Answer. B. Bradycardia developing after prolonged tachycardia. Rationale: bradycardia is often a late and ominous sign of severe hypoxia in children and may precede cardiopulmonary arrest. Question 7. A child with respiratory distress is noted to be sitting upright, leaning forward with arms extended. Which nursing interpretation is correct? A. Child is preparing to ambulate. B. Child is displaying tripod positioning to maximize ventilation. C. Child is demonstrating normal play behavior. D. Child is attempting to reduce fever. Answer. B. Child is displaying tripod positioning to maximize ventilation. Rationale: tripod positioning is a compensatory mechanism used by children experiencing severe respiratory distress to improve chest expansion and airflow. Question 8. A nurse is caring for a child with suspected epiglottitis. Which action should be avoided? A. Maintaining a calm environment. B. Keeping emergency airway equipment available. C. Forcing visualization of the throat with a tongue depressor. D. Administering oxygen as tolerated. Answer. C. Forcing visualization of the throat with a tongue depressor. Rationale. Manipulation of the airway can trigger complete airway obstruction in a child with epiglottitis and should be avoided. Question 9. A 9-month-old infant has severe respiratory distress. Which assessment finding is considered a late sign requiring immediate action? A. Tachypnea. B. Nasal flaring. C. Retractions. D. Decreased level of consciousness. Answer. D. Decreased level of consciousness. Rationale. Altered mental status is a late indicator of inadequate oxygenation and ventilation and suggests impending respiratory failure. Question 10. A child admitted for acute respiratory illness initially cries vigorously during assessment. 2 hours later, the nurse notes weak crying, poor muscle tone, shallow respirations, and reduced responsiveness. What is the priority nursing action? A. Encourage oral fluids. B. Continue routine monitoring. C. Activate rapid response and prepare for airway support. D. Place the child in a supine position. Answer. C. Activate rapid response and prepare for airway support. Rationale. Weak cry, hypotonia, shallow respirations, and decreased responsiveness are signs of impending respiratory failure requiring immediate intervention. Question 11. A 4-year-old child with severe pneumonia has been receiving oxygen therapy for several hours. During reassessment, the nurse notes a respiratory rate that has decreased from 58 breaths/min to 24 breaths/min. Oxygen saturation has dropped from 94% to 88%, and the child appears increasingly drowsy. Which interpretation is most appropriate? A. The child is responding positively to oxygen therapy. B. The child is becoming less anxious and therefore breathing slower. C. The child is experiencing respiratory muscle fatigue and impending respiratory failure. D. The child is entering the recovery phase of illness. Answer. C. The child is experiencing respiratory muscle fatigue and impending respiratory failure. Rationale. A declining respiratory rate accompanied by worsening oxygenation and lethargy is a dangerous sign of respiratory muscle exhaustion and impending respiratory failure. Question 12. A nurse is assessing a 2-year-old with bronchiolitis. Which assessment finding most strongly suggests severe respiratory distress requiring escalation of care? A. Mild wheezing. B. Occasional cough. C. Head bobbing with each breath. D. Clear nasal drainage. Answer. C. Head bobbing with each breath. Rationale. Head bobbing is a sign of significant respiratory effort in infants and toddlers and indicates severe respiratory distress. Question 13. A 7-year-old with status asthmaticus has received multiple bronchodilator treatments. Which assessment finding is most concerning? A. Persistent expiratory wheezes. B. Heart rate of 132 beats/min. C. Inability to speak more than one word at a time. D. Mild anxiety. Answer. C. Inability to speak more than one word at a time. Rationale. Inability to speak due to dyspnea indicates severe respiratory compromise and inadequate airflow. Question 14. A nurse caring for a child with severe respiratory distress observes substernal, intercostal, and supraclavicular retractions simultaneously. What does this finding indicate? A. Mild respiratory effort. B. Normal pediatric breathing pattern. C. Significant increase in work of breathing. D. Resolution of airway obstruction. Answer. C. Significant increase in work of breathing. Rationale. Multiple retraction sites indicate severe respiratory distress and increasing use of accessory muscles. Question 15. A 10-month-old infant with RSV becomes increasingly irritable despite adequate hydration and antipyretics. Oxygen saturation is 89%. Which explanation best accounts for the infant's behavior? A. Hunger. B. Sleep deprivation. C. Hypoxemia. D. Separation anxiety. Answer. C. Hypoxemia. Rationale. Irritability is often an early sign of hypoxemia in infants before more obvious signs of respiratory failure develop. Question 16. The nurse is assessing a child with upper airway obstruction. Which finding most clearly indicates a worsening obstruction? A. stridor only when crying. B. Stridor only during activity. C. Stridor present at rest. D. Intermittent cough. Answer: C. Stridor present at rest. Rationale: stridor at rest indicates significant airway narrowing and increased risk of complete airway obstruction. Question 17. A child with severe asthma suddenly develops cyanosis around the lips despite receiving oxygen therapy. What should the nurse recognize? A. Oxygen therapy is effective. B. Cyanosis is an early sign of hypoxia. C. The child has developed a late sign of severe hypoxemia. D. The child is experiencing medication side effects. Answer: C. The child has developed a late sign of severe hypoxemia. Rationale: cyanosis is a late and serious sign indicating inadequate oxygenation and potential respiratory failure. Question 18. A pediatric intensive care nurse is assessing a child with respiratory distress. Which trend is most concerning? A. Respiratory rate 48 to 50 breaths/min. B. Oxygen saturation 97% to 96%. C. Heart rate 140 to 70 beats/min with worsening respiratory effort. D. Mild increase in temperature. Answer: C. Heart rate 140 to 70 beats/min with worsening respiratory effort. Rationale: bradycardia developing in the setting of respiratory distress is a critical warning sign of severe hypoxia and impending arrest. Question 19. A nurse is evaluating a toddler with suspected foreign body aspiration. Which assessment finding requires immediate intervention? A. Mild cough after drinking water. B. Intermittent wheezing. C. Sudden onset of respiratory distress with unilateral decreased breath sounds. D. Clear nasal discharge. Answer: C. Sudden onset of respiratory distress with unilateral decreased breath sounds. Rationale: sudden respiratory distress accompanied by decreased breath sounds on one side strongly suggests airway obstruction from a foreign body. Question 20. A 3-year-old child hospitalized for severe respiratory illness is receiving high-flow oxygen therapy. Which finding indicates progression from respiratory distress to respiratory failure? A. Tachypnea and retractions. B. Nasal flaring and irritability. C. Drowsiness with shallow respirations. D. Increased respiratory effort. Answer: C. Drowsiness with shallow respirations. Rationale: drowsiness and shallow breathing indicate inadequate ventilation and are classic signs that respiratory failure is developing. Question 21. A 6-year-old child is admitted with severe status asthmaticus. During the initial assessment, the nurse notes marked wheezing throughout all lung fields. 2 hours later, the child is increasingly lethargic, and auscultation reveals barely audible breath sounds with minimal wheezing. Which interpretation is most accurate? A. Bronchodilator therapy has resolved the bronchospasm. B. The child is developing fluid overload. C. Air movement has become critically reduced, indicating impending respiratory failure. D. The child is resting comfortably after treatment. Answer: C. Air movement has become critically reduced, indicating impending respiratory failure. Rationale: a decreasing wheeze in a severely asthmatic child is not always improvement. A silent chest indicates minimal airflow and represents a medical emergency. Question 22. A 15-month-old with bronchiolitis demonstrates nasal flaring, grunting, severe retractions, and oxygen saturation of 85% despite supplemental oxygen. Which assessment finding is the strongest indicator that respiratory failure may be imminent? A. Persistent cough. B. Severe retractions. C. Grunting respirations. D. Progressive lethargy. Answer: D. Progressive lethargy. Rationale: altered mental status is a late and serious sign of worsening hypoxia and hypercapnia and often precedes respiratory arrest. Question 23. A nurse is caring for a child with severe croup. Which assessment finding would require immediate notification of the healthcare provider? A. Barking cough. B. Hoarseness. C. Restless behavior progressing to decreased responsiveness. D. Low-grade fever. Answer: C. Restless behavior progressing to decreased responsiveness. Rationale: restlessness is often an early sign of hypoxemia, while decreased responsiveness is a late sign suggesting worsening oxygen deprivation. Question 24. A 5-year-old child with pneumonia has a respiratory rate of 62 breaths/min and significant intercostal retractions. Which additional assessment finding would indicate the highest priority concern? A. Refusal to eat. B. Capillary refill of 2 seconds. C. Weak peripheral pulses and declining level of consciousness. D. Productive cough. Answer. C. Weak peripheral pulses and declining level of consciousness. Rationale: decreased perfusion and altered consciousness suggest severe hypoxemia and possible progression toward cardiopulmonary collapse. Question 25. A nurse is assessing an infant with respiratory distress. Which finding represents a compensatory mechanism designed to improve oxygenation? A. Bradycardia. B. Apnea. C. Nasal flaring. D. Decreased responsiveness. Answer. C. Nasal flaring. Rationale: nasal flaring increases airway diameter and reduces resistance, helping infants improve airflow during respiratory distress. Question 26. A child with severe respiratory distress suddenly develops irregular respiratory patterns. Which action should the nurse take first? A. Reassess in 30 minutes. B. Document findings and continue observation. C. Activate emergency response and prepare for advanced airway management. D. Encourage oral hydration. Answer. C. Activate emergency response and prepare for advanced airway management. Rationale: irregular respirations in a child with respiratory distress suggest impending respiratory arrest and require immediate intervention. Question 27. A nurse is caring for a 2-year-old with epiglottitis. Which finding would most strongly suggest critical airway obstruction? A. Fever. B. Drooling and tripod positioning. C. Hoarseness. D. Refusal to eat. Answer. B. Drooling and tripod positioning. Rationale: drooling occurs because the child cannot swallow secretions. Combined with tripod positioning, it strongly suggests severe upper airway obstruction. Question 28. A child with acute respiratory distress develops increasing carbon dioxide retention. Which assessment finding would the nurse most likely observe? A. Hyperalert behavior. B. Increased level of consciousness. C. Confusion and drowsiness. D. Increased appetite. Answer. C. Confusion and drowsiness. Rationale: hypercapnia depresses neurological function, leading to confusion, drowsiness, and eventually decreased responsiveness. Question 29. A pediatric nurse is monitoring a child with severe asthma. Which trend requires the most urgent intervention? A. Respiratory rate decreasing from 52 to 40 breaths/min while oxygen saturation improves. B. Respiratory rate remaining elevated with stable oxygen saturation. C. Respiratory rate decreasing from 52 to 24 breaths/min while lethargy increases. D. Respiratory rate increasing from 32 to 40 breaths/min during activity. Answer. C. Respiratory rate decreasing from 52 to 24 breaths/min while lethargy increases. Rationale: a falling respiratory rate accompanied by worsening mental status often indicates respiratory muscle fatigue and impending respiratory failure. Question 30. A nurse is caring for a child with severe respiratory compromise. Which finding most strongly suggests that hypoxemia has become life-threatening? A. Mild anxiety. B. Tachypnea. C. Nasal flaring. D. Bradycardia with decreased responsiveness. Answer. D. Bradycardia with decreased responsiveness. Rationale: bradycardia and altered consciousness are late signs of severe hypoxemia and frequently precede respiratory and cardiac arrest in pediatric patients. Question 31. A 3-year-old child with severe bronchiolitis has been receiving high-flow nasal cannula oxygen therapy. During reassessment, the nurse notes that the child's retractions have slightly decreased, but the child is now difficult to arouse and has a respiratory rate that has fallen from 60 to 26 breaths/min. Which interpretation is most appropriate? A. Oxygen therapy has resolved the respiratory distress. B. The child is sleeping normally due to exhaustion from illness. C. Respiratory muscle fatigue is leading to impending respiratory failure. D. The child is demonstrating a normal pediatric response to treatment. Answer. C. Respiratory muscle fatigue is leading to impending respiratory failure. Rationale. A reduction in respiratory effort accompanied by lethargy and a falling respiratory rate is a dangerous sign of respiratory muscle exhaustion rather than improvement. Question 32. A 7-month-old infant with RSV develops increasing nasal flaring, severe retractions, and oxygen saturation of 86%. Which nursing action is the priority? A. Offer oral fluids. B. Increase stimulation to keep the infant awake. C. Escalate respiratory support and notify the provider immediately. D. Reassess in 1 hour. Answer. C. Escalate respiratory support and notify the provider immediately. Rationale. Severe respiratory distress with hypoxemia requires immediate intervention to prevent progression to respiratory failure. Question 33. A nurse is caring for a child admitted with bacterial pneumonia. Which assessment finding most strongly indicates that oxygen delivery to tissues is becoming inadequate? A. Fever of 38.9 degrees Celsius, 102 degrees Fahrenheit. B. Persistent cough. C. Altered mental status. D. Mild tachycardia. Answer. C. Altered mental status. Rationale. Changes in consciousness are among the most significant indicators of inadequate cerebral oxygenation and worsening respiratory compromise. Question 34. A 4-year-old with severe asthma becomes increasingly agitated and repeatedly attempts to remove the oxygen mask. Which interpretation is most appropriate? A. The child dislikes the mask. B. The child is demonstrating age-appropriate behavior. C. Agitation may be an early sign of worsening hypoxemia. D. The child is responding well to treatment. Answer. C. Agitation may be an early sign of worsening hypoxemia. Rationale. Agitation, restlessness, and irritability often occur before more obvious signs of oxygen deprivation appear. Question 35. A child with respiratory distress is noted to have pronounced use of neck muscles during inspiration. Which conclusion should the nurse make? A. Normal pediatric breathing pattern. B. Mild airway irritation. C. Significant accessory muscle use indicating increased work of breathing. D. Resolution of respiratory distress. Answer. C. Significant accessory muscle use indicating increased work of breathing. Rationale. Neck muscle use indicates that normal respiratory muscles are insufficient and the child is working harder to breathe. Question 36. A 5-year-old with severe croup develops stridor that is audible without a stethoscope while resting quietly in bed. What should the nurse recognize? A. Mild upper airway narrowing. B. Improving respiratory status. C. Severe airway obstruction requiring urgent intervention. D. Normal finding in croup. Answer. C. Severe airway obstruction requiring urgent intervention. Rationale. Loud stridor at rest indicates critical airway narrowing and can rapidly progress to complete obstruction. Question 37. A nurse caring for a child with respiratory distress observes cyanosis despite administration of supplemental oxygen. Which interpretation is most accurate? A. Oxygenation is adequate. B. Cyanosis is expected in pediatric respiratory illness. C. Severe hypoxemia is present and immediate intervention is required. D. The oxygen delivery device is unnecessary. Answer. C. Severe hypoxemia is present and immediate intervention is required. Rationale. Cyanosis despite oxygen therapy indicates profound oxygenation failure and is a late, life-threatening sign. Question 38. A child admitted for respiratory distress develops pauses in breathing lasting several seconds. Which nursing action has the highest priority? A. Document the finding. B. Encourage coughing. C. Initiate emergency assessment and prepare for airway support. D. Reduce environmental stimulation. Answer. C. Initiate emergency assessment and prepare for airway support. Rationale. Apnea is a critical sign of respiratory failure and requires immediate intervention. Question 39. A pediatric nurse is assessing a child with worsening respiratory distress. Which finding most strongly suggests carbon dioxide retention? A. Alertness and increased activity. B. Drowsiness and confusion. C. Increased appetite. D. Improved speech. Answer: B. Drowsiness and confusion. Rationale: elevated carbon dioxide levels depress the central nervous system, resulting in confusion, drowsiness, and reduced responsiveness. Question 40. A child hospitalized with severe respiratory illness initially demonstrates tachycardia. Several hours later, the nurse notes bradycardia, weak respiratory effort, and poor responsiveness. What is the nurse's priority action? A. Continue observation. B. Encourage fluid intake. C. Activate emergency response and prepare for resuscitative interventions. D. Administer an antipyretic. Answer: C. Activate emergency response and prepare for resuscitative interventions. Rationale: bradycardia, poor responsiveness, and weak respirations are late signs of severe hypoxia and often precede cardiopulmonary arrest in pediatric patients. Question 41. A 2-year-old child with severe pneumonia has been receiving oxygen therapy. The nurse notes increasing lethargy, diminished breath sounds, shallow respirations, and oxygen saturation of 84%. Which assessment finding is most indicative of impending respiratory arrest? A. Tachypnea. B. Nasal flaring. C. Shallow respirations with decreased responsiveness. D. Productive cough. Answer: C. Shallow respirations with decreased responsiveness. Rationale: shallow respirations combined with altered consciousness indicate inadequate ventilation and impending respiratory arrest. Question 42. A 9-month-old infant with bronchiolitis has severe intercostal and substernal retractions. During reassessment, the nurse notices the infant's retractions suddenly decrease, but the infant becomes limp and minimally responsive. What should the nurse conclude? A. Respiratory status is improving. B. The infant is sleeping comfortably. C. Respiratory muscle exhaustion has likely developed. D. Bronchodilator therapy has been successful. Answer: C. Respiratory muscle exhaustion has likely developed. Rationale: a sudden reduction in retractions accompanied by lethargy often reflects respiratory fatigue rather than improvement. Question 43. A 6-year-old child with status asthmaticus is receiving aggressive treatment. Which finding should prompt immediate intervention? A. Persistent wheezing. B. Heart rate of 128 beats/min. C. Absence of wheezing with markedly diminished air movement. D. Mild anxiety. Answer: C. Absence of wheezing with markedly diminished air movement. Rationale: a silent chest indicates critical airflow obstruction and impending respiratory failure. Question 44. A child with severe upper airway obstruction is sitting upright, drooling, and leaning forward. Which nursing intervention is most appropriate? A. Force oral fluids. B. Place the child supine for examination. C. Minimize agitation while preparing for advanced airway management. D. Inspect the throat with a tongue depressor. Answer: C. Minimize agitation while preparing for advanced airway management. Rationale: children with significant upper airway obstruction should remain calm, and airway equipment should be readily available because obstruction can rapidly worsen. Question 45. A nurse is caring for a toddler experiencing respiratory distress. Which finding indicates the child is no longer able to compensate effectively? A. Tachycardia. B. Nasal flaring. C. Intercostal retractions. D. Bradycardia. Answer: D. Bradycardia. Rationale: bradycardia is a late sign of severe hypoxia and indicates decompensation rather than compensation. Question 46. A 4-year-old child with severe respiratory illness becomes increasingly confused and difficult to arouse. Arterial blood gas results reveal rising carbon dioxide levels. Which pathophysiological process explains these findings? A. Improved ventilation. B. Carbon dioxide retention causing central nervous system depression. C. Increased oxygen delivery to tissues. D. Resolution of airway inflammation. Answer: B. Carbon dioxide retention causing central nervous system depression. Rationale: hypercapnia depresses neurological function, producing confusion, lethargy, and decreased responsiveness. Question 47. A child admitted with acute respiratory distress demonstrates nasal flaring, retractions, tachypnea, and grunting. Which finding is considered the most serious indicator that gas exchange is failing? A. Tachypnea. B. Retractions. C. Grunting. D. Decreasing level of consciousness. Answer. D. Decreasing level of consciousness. Rationale. Altered mental status is a late sign of inadequate oxygenation and ventilation and signals worsening respiratory failure. Question 48. A pediatric nurse is evaluating a child with worsening respiratory compromise. Which trend should be reported immediately? A. Respiratory rate remains elevated but stable. B. Oxygen saturation improves after treatment. C. Respiratory effort decreases while mental status deteriorates. D. Mild reduction in fever. Answer. C. Respiratory effort decreases while mental status deteriorates. Rationale. Reduced respiratory effort accompanied by worsening mental status is characteristic of respiratory fatigue and impending failure. Question 49. A child with severe asthma has oxygen saturation of 82%, cyanosis, poor muscle tone, and weak respiratory effort. Which nursing action is the highest priority? A. Encourage coughing and deep breathing. B. Administer oral fluids. C. Prepare for immediate airway and ventilatory support. D. Place the child in a flat position. Answer. C. Prepare for immediate airway and ventilatory support. Rationale. Severe hypoxemia with cyanosis and weak respiratory effort requires urgent airway stabilization and ventilatory assistance. Question 50. A nurse is caring for a child whose respiratory distress has progressed over several hours. Which assessment finding most strongly indicates that the child has entered respiratory failure rather than respiratory distress? A. Nasal flaring. B. Intercostal retractions. C. Tachypnea. D. Decreased responsiveness with inadequate respiratory effort. Answer. D. Decreased responsiveness with inadequate respiratory effort. Rationale. Respiratory distress is characterized by increased work of breathing. Respiratory failure occurs when the child can no longer maintain adequate oxygenation or ventilation, resulting in decreased responsiveness and inadequate respiratory effort. That wraps up our 50 Nclex, the most critical respiratory distress, the most missed pediatric sign review. Remember, in pediatric respiratory emergencies, the child who is becoming quiet, lethargic, or less responsive is often much more concerning than the child who is crying, restless, or fighting the oxygen mask. A change in mental status can be one of the earliest clues that compensation is failing and respiratory failure is approaching. For Nclex success, always recognize the progression. Respiratory distress, tachypnea, nasal flaring, retractions, grunting, restlessness, tachycardia, respiratory failure, decreased level of consciousness, diminished breath sounds, weak respiratory effort, cyanosis, bradycardia, apnea. When in doubt, remember this Nclex rule. The child who is tiring out is the child who is running out of time. If you found this practice set helpful, be sure to like, share, and subscribe to MCQs Master 101 for more advanced Nclex style questions, NG and case studies, SATA practice, prioritization drills, and critical care reviews. Stay focused, keep practicing, and I'll see you in the next Nclex session. Until then, study smart, think like a nurse, and keep moving toward that RN license.